For our next segment, we go to reporter Laura Windsor, who has a story that will be of interest to many women.
When the muscles and ligaments supporting a woman's pelvic organs weaken, the pelvic organs can slip out of place. We spoke to urogynecologist Dr. Matthew Clark at Hoag Memorial Hospital Presbyterian in Newport Beach about a condition called pelvic organ prolapse and what causes this condition.
We think the cause of pelvic organ prolapse is the loss of connective tissue and muscle support. The first and biggest cause is childbirth, but certainly women that don't have babies can also have prolapse. Anything that increases the abdominal pressure, chronic coughing, chronic constipation, work hazard, someone that works for UPS and lifts heavy boxes. Stay-at-home moms have a lot of hard work that they do. Those are also at risk for pelvic organ prolapse.
Dr. Clark tells us at what age a woman could get this condition.
I've seen pelvic organ prolapse in women in their 20s, but the most common presentation is probably a woman in her 40s to 50s. The average surgical age in my population is a woman in her mid-60s.
Dr. Clark explains the treatments for this condition.
Three main treatment algorithms. Number one is it can be just observed. Surgery is not necessary, but for some women, the loss of quality of life and the constant sense of pressure will drive them to need treatment. When we start with treatment, we have one conservative option, and that's the use of a support pessary. These are plastic ring devices that are worn inside the vagina, like a diaphragm, that will hold up the bladder or support the uterus in a normal position. Pessaries are acceptable to some women, but most women will pass and move towards surgical correction. So surgery is probably our fundamental cornerstone treatment for pelvic organ prolapse. Currently today we have great surgical options to treat pelvic organ prolapse, and we're able to offer patients surgery with a high chance for success, with a short hospital stay and a rapid return to recovery.
The lifetime risk that a woman will have surgery for the correction of prolapse is about 11%.
For most of our patients, the surgery is a 1 to 2 hour procedure. They're able to stay just one night in the hospital. We're returning to work in 2 to 4 weeks, and they're able to be back fully functioning in about 6 to 8 weeks. The more severe version of pelvic organ prolapse is the larger prolapses. They are handled best currently with the operating robot, the Da Vinci robot. This surgery is able to provide the gold standard support procedure for patients with large prolapse. Currently, with the operating robot, because of the great vision that we have, the precision that we're able to operate with, and the minimal invasive incisions, we can operate and perform this surgery with a one-night stay, and patients are able to return to work in full function within 2 weeks.
Approximately 200,000 procedures for correction of pelvic organ prolapse are performed each year in the United States.
We really need to engage the pelvic floor muscles, and some women don't know where the Kegel muscle is. So number one, Kegel muscle exercise programs are very real, very important. Yoga and Pilates definitely engage the pelvic floor, so those exercises can be very helpful. Avoiding constipation is also a very helpful piece. Those are the two big factors that I think patients can influence. Otherwise, you're born with the genes, you're born with your pelvic floor size, you're going to have your families, you're going to do your work, and we're here to take care of it if it happens.
It is estimated that nearly 50% of all women between the ages of 50 and 79 have some form of prolapse. New advances in corrective surgery and procedures relieve women of having to live with this condition. For the American Health Journal, I'm Laura Windsor.